Trichomonas Vaginalis. Trichomonas belongs to the phylum Metamonada, class Parabasalis, order Trichomonadia, family Trichomonadiae, genus Trichomonas, and the species of importance is the Trichomonas vaginalis. There are three species of the genus Trichomonas which are commonly found in human. These are Trichomonas vaginalis. It is the only pathogen that resides in the genital tract. And the Pentatrichomonas hominis is a non-pathogen which resides in large intestine. And the Trichomonas tenax. It is also non-pathogenic and it resides in the mouth. As we already said, the Trichomonas have three species which we see in humans: the Trichomonas vaginalis, the Trichomonas hominis, and the Trichomonas tenax. Let's learn about the pathogen, that is the Trichomonas vaginalis. It is a flagellate, that means the bacteria containing flagella. It differs from other flagellates as they lack cyst stage. So during the development, this Trichomonas lack the cyst stage. It causes STDs. The females are more commonly affected than males. Coming to the morphology, the trophozoites are a pear-shaped or piriform shaped structures. Their size varies up to 7 to 23 micrometers in length and 5 to 15 micrometers in width. As they contain flagella, they show jerky or twitchy motility in the saline solution. And remember, these trophozoites bear 5 flagellates, as you can see it in this diagram. Coming to the life cycle. The trophozoites in the vagina and the prostatic secretions and the urine multiplies by longitudinal binary fission, and the trophozoite in the vagina or the urethral orifice is noted. So this stage where the trophozoite is present in the vagina or the urethral orifice is the infective stage of this disease, and during the process of the sexual intercourse, it passes from one person to the another person. So, as we learned, the trophozoites are the infective stage as well as of the diagnostic stage. The disease is transmitted by the sexual mode, and the trophozoites divide themselves by the longitudinal binary fission, which gives rise to the daughter trophozoites present in the urogenital tract, which infect the other individuals. Clinical features. Trichomonas vaginalis causes trichomoniasis. It is the common parasitic cause of the sexually transmitted disease, and it is worldwide in distribution, and it accounts for about 10% of the cases of vulvovaginitis. And the incubation period is 4 to 28 days. An asymptomatic infection is seen in about 25 to 50% of the people. In cases of acute infection, the females are commonly affected, and they are mainly presented with features of vulvovaginitis that is characterized by foul smelling, yellowish green, purulent discharge containing polymorpholeucocytes, strawberry appearance of the vagina, dysuria, and the lower abdominal pain. And in males, it is often asymptomatic and non-gonococcal urethritis, and rarely epididymitis, prostatitis, and the penile ulceration is seen. In cases of chronic infection, pruritus and pain during coitus is noted. Coming to the laboratory diagnosis, the sample collection. The sample collection is usually taken from the vaginal, urethral discharge, urine sediment, or prostatic secretions. In the direct microscopy, wet or the saline mount is prepared, in which we can note the jerky motile trophozoites and even the pus cells. The permanent stain is the Giemsa and the panicula stain. It demonstrates the morphology of the trophozoites. Acridine orange fluorescent stain and the direct fluorescent antibody test is also used for the diagnosis of this disease. The culture is the gold standard method for the diagnosis of this disease. The culture media is the cystine peptose liver maltose media, and the incubation is done at 35 to 37 degrees Celsius for about 3 to 4 days. The antigen detection in the vaginal secretion is done by the ICT and the ELISA. Antibody detection is done by ELISA. The molecular method for this disease is done by the PCR of Trichomonas Vaginalis specific beta tubulin genes, and the other supportive tests are the raised vaginal pH and the positive whiff test, and excessive neutrophils are tested for the diagnosis. The treatment of Trichomonas vaginalis is done by metronidazole and the tinidazole. Trichomoniasis can be prevented by the treatment of both the sexual partners and safe sex practices like using of condoms and avoiding sex with infected persons, and the vaccination for this trichomoniasis is on trail. So guys, this is all about the disease Trichomonas vaginalis. If you like this lecture, do subscribe to my channel.